Hey everybody, welcome to, I believe it's week 11, 28-23. Look, I got my numbers backwards up there. I said 23-28. This week we're talking about nursing research. I think it's called Informatics and Evidence-Based Practice on your syllabus. This is chapter 4 in your book. I typically don't give a lot of page numbers or references when I do a lecture, but with this one I'm going to, just because the information is very new to a lot of you. And I want to make sure you understand what we're talking about. So I'm not sure I'm going to get this done in 15 minutes. There may be another lecture, but let's get started. Maybe if my screen will move. Okay, so research in nursing. We're doing research to expand a profession's knowledge base, and that's huge in the medical field because things are changing on a day-to-day basis. This can come from many different areas: biomedical, environmental, psychological, and there's been several advances in modern healthcare. Some of the most recent ones that I've seen, some of the big ones are like new nurse, not really I guess you call them internships, but new nurse orientations were really big a few years ago, and they still are, but that was a big research project that a lot of people did, which brought, it was just like a program that new nurses went through when they got to a hospital. And they would have meetings together as new nurses, and they would do activities together and go through some of the competency things. And they really felt that helped new nurses come into the profession. So that's an example of one. There are several. But improving patient outcomes is really big right now. The project that I did for my DNP was improving diabetics' A1C scores and their self-efficacy. So anything that can improve patient outcomes, falls, technology advances, those are all things that can be done as far as research in nursing goes. Nurses must be able to discriminate between well-conducted studies and weak ones. We're going to talk about that a little bit later on in the presentation. Precepting, that's another one I wrote down. So having a nurse preceptor, that's another research that I'm going to guess has been going on for at least 10 years, but used to when nurses came out, they didn't have preceptors. So this is something that they researched and is now being implemented. So again, chapter 4, this starts, I believe, on page 51. This came right off page 52. So this is, nursing research is a systematic inquiry into the problems encountered in the nursing practice. So here's some examples: support and comfort, prevention of trauma, promotion of recovery, health education, health appraisal, coordination of care. So a lot of things that we can research. ANA stands for American Nurse Association. So nursing research is typically ANA focused. So again, improving the quality of care, improving safety. Some relevant research is laboring positioning, maybe cancer pain management. Fall prevention is huge. So we, I don't want to say recently implemented, but we have, if you work in the hospital, you've probably heard of fall risk scores. So we score our patients and what their fall risk is. And new nurses, which we've talked about. So just a history, historical trends, not twins, in nursing research. So Florence Nightingale, I'm sure that you've read a little bit about her. She documented the care that she gave soldiers in the war. And then 1900s to 1940s, it was really centered around education. 1950s and 60s, more master's programs emerged, which is mind-boggling to me that in the 50s, nurses were thinking about getting a master's degree. During this time, that's when we had our first research classes. In the 1960s, PhDs became pretty common, or more common, I guess I should say. 1970s and 80s, we had research journals. So you guys can subscribe to nursing research journals. You can pay to be part of them, and you get an issue every month, or however often they have it set up. Professional organizations began to establish research priorities. In the 1990s to present, you get the NCNR, and in 2016 we had a new set of research priorities. So nursing has come a long way. Evidence-based practice. This is the main thing that I wanted to talk about today, and what I'm interested in, and you really sinking in and learning about. Evidence-based practice is an approach to healthcare that realizes that pathophysiologic reasoning and personal experience alone are not sufficient for making decisions. Evidence-based practice nursing is the utilization of the results of scientific studies. So when we talk about evidence-based practice and we write a paper on evidence-based practice, which is what you're going to be doing, you're not trying to come up with a new idea. What you're doing is researching an idea and putting it into practice. Someone else has already done all of the fundamental research. What you're doing is taking what they've found and putting it into practice to see if it works for you, if that makes sense. Okay, so if you think of like someone who has a PhD, those individuals are doing the groundwork for research. Okay, they're coming up with new ideas and actually doing research studies. What we're doing is going and reading those research studies and seeing if we can take what they did and put it in to our situation. Okay, so for example, I told you I worked with type 2 diabetics for my DNP project. So I researched ways to educate type 2 diabetics and what would work for them. And then I put it into practice, and I pulled my own results of how that worked in a rural setting. So I took somebody else's research that they wrote an article on, several articles. When you do literature review, you're going to find several, and made my own out of all that. I hope that kind of makes sense. But that's what evidence-based practice is. We're going out there and finding what's out there and seeing if it can fit and help us in the situation that we're in. Sorry about my phone ring. So nursing research supports the professional goals of nursing. We already talked about this a little bit. Areas of research by the American Nurses Association. So safety is a huge one. How do we keep patients safe? How do we keep people from falling? The healthcare workforce, improvements in nursing efficiency. Those are some common areas. Different types of research. This is on box 4.1 in your book. Let's see if I can give you a page number. I believe it's like 56, 54, somewhere around there. Yeah, 4.1. So there's different types of research that we're going to go over. We'll talk a little bit more in class, but systematic research is a design that compares the effectiveness with different interventions. This box also talks about systematic reviews, meta-analysis, and where you can find those at. But the goal is to find an intervention that is best for a given patient within the specific circumstances. The main goal of nursing research is to generate fundamental knowledge to guide nursing practice. So you probably won't notice it in the hospital when you go, but there's constantly evidence-based practice going on. We're constantly trying to gain more knowledge on how we can do something better or more efficient. In addition to generating knowledge, nurse scientists are expanding the overall sum of nursing knowledge. For example, economic impacts related to staffing mix. I recently heard because of the COVID shortage, hospitals are considering bringing LPNs back in and going back to where nurses have a team where they may be one nurse, 2 LPNs, and a tech, or one nurse and 2 LPNs, and the nurses to delegate, all these tasks out. Whether that's a good or bad thing, I'm not going to comment on, but that would be an economic impact. Another economic issue within nursing is how much it costs to train a new nurse, and then they leave within 6 months, and now we have to train another nurse. How do we keep nurses? How do we retain nurses on the floor? So those are some issues there. Properties of nursing research. This comes from page 56. We're going to talk about nursing problems. A research problem is a nursing research problem when nurses have access to and control over the phenomenon being studied. So don't get too outside of your, I can't think of the word, of what you can do. Okay, so we don't want to do a research study on maybe a certain kind of drugs during surgery. Okay, that's not something we have control over. We don't have control over what the physician is ordering, right? Things that we do have control over are safety issues, maybe doing some breathing exercises after surgery, maybe getting up and walking the first day after a knee surgery. Those are things that we as nurses have control over. Anything education-wise, we would have control over. So when you think of a nursing research problem or a research problem in general, keep in mind that it needs to be simple. It needs to be something that you can implement. I had a student once in the R&DS program do a research project on implementing hand sanitizer on we call them cows, but now you can't call them that anymore, computer on wheels. So having hand sanitizer on the computer on wheels and how that was beneficial to nurses. And that's fine. That's simple. It's very simple. Some people will do the research project again on falls. That's an easy one. There's lots of different research questions you can ask, but be thinking of that. Between this lecture and coming to class, and especially before coming to lab, what is something that you could research in nursing? And maybe it's something to do with education, how to educate patients that you could do. Maybe educating before surgery, maybe educating before they go home, maybe something on diet. There's a lot of things that we can implement as nurses, but we need to keep it simple. So there's different types of nursing research, and these next couple slides have a lot of vocab in them. So I'm not really going to read them to you, but quantitative is measurable. Okay, so if we're dealing with numbers, if we're looking at two different things and comparing, that would be quantitative. Qualitative is not measurable. We're looking at more of a narrative data here, maybe subjective data, maybe more of an emotional type response or feelings. Okay, that would be qualitative. And if you do mixed methods, you're doing both. Problem area identification. Okay, so we're going to talk about PICO, and this is on page 57 and 58. A PICO question, which you will have to write in order in your paper. This will be part of your paper. You will need to write a PICO question. So P stands for the patient or the problem or the population. Okay, so you can be as specific as saying in a 74-year-old woman, or you could be, I like to use more of a population. In patients who have had knee surgery, okay, that could be a population. Intervention, I'm pulling this right out of page 58. So this one says in a 72-year-old woman with osteoarthritis of the knee. So that's your population. How does opioid medication, okay, so that's your intervention, compared to non-opioid pain management, okay, that's your comparison, and what's your outcome? I lost my spot, sorry. Affect pain and fall risk after knee replacement surgery. Okay, so it can be something so simple, and I think you probably, off the top of your head, you probably know what the answer to that is. How does opioid pain medicine compared to non-opioid pain medication techniques help with pain? Well, I'm sure opioid pain medication is going to be more effective. Whatever you do for a PICO question, I want it to be even more simple than that. Because at this point, as nursing students, we're really not giving medications. We will next semester, but we want to keep it simple. And I've got a list that we'll talk about in class of some ideas that you could do for research, but be thinking between now and then of what you can do. So again, PICO question, page 58, box 44. It'll show you how to go through a PICO question. You can also put time on there. Some questions work really well with time. Some of it doesn't work well. Okay. I'm going to pause this and start another video, and we will finish these last few slides out.